doctor's diary is Dr. Kizzie Shako. As a police surgeon, her work is to deal with victims of gender and sexual-based violence.
I'm Dr. Kizzie Shako. I'm a forensic medical practitioner. I work for the Ministry of Health, Forensic and Pathology Services, and I have been deployed to the police service as well as a police surgeon. A police surgeon is basically a forensic medical practitioner or a forensic physician, forensic medical officer. It's a medical officer or a medical practitioner who works on cases that are forensic in nature or cases that deal with criminal matters. So, for example, sexual violence cases, in examinations and collection of evidence from child abuse cases, whether it's victims or suspects, giving expert testimony in court, that happens quite a bit, and such like cases. So that's basically the bulk of what a police surgeon's work is. I also do a lot in the field because my area of expertise is clinical forensic medicine, which is a very new kind of concept in our setting in Kenya. It's not a well understood field. So I do a lot in terms of formulation of policy documents, capacity building of medical practitioners, police officers, different stakeholders involved in the criminal justice system, where we are discussing criminal matters that involve the living injured especially. Other cases would be like motor vehicle collisions, where we interpret injuries and document them. And this is what forms the evidence. Evidentiary material that will then be produced in court, and occupational hazards, animal attacks, basically anywhere that a person has sustained an injury and either needs a medical legal report or some kind of judicial outcome is required. I was an only child for 7 years before my brother was born, and what brought me into this journey, where my journey began into forensics, started way back when I was 5, because I found death scenes very intriguing. I was interested in death investigations. I liked mysteries, so sometimes I'd even wander off into a field looking for bones, maybe, thinking maybe someone could have died there and we need to find out who it was. I guess the movies really influenced a lot of this. And that's where my journey began. So for me, since I was 5, I knew exactly what I was going to do with my life. And I thank God for that, because I can tell, some people really struggle with that. And so I joined med school, finished. But then when I was about to apply for pathology, by then I was already working in the forensic and pathology department and conducting autopsies under supervision of pathologists, some forensic pathologists. And I realized I didn't really want that. I thought it was too narrow a field. I think I wanted more. I wanted a broader view of things. So I just, I went ahead and joined a master's in forensic medicine program. It wasn't quite what I wanted at the time, but that's the door that opened, and so I took it, and that's when I learned all about the living injured. And about that time is when I was sent to the police surgery, which was a coincidence. And I now came face to face with all these victims of, every single person in that office is someone who has been injured by another person. Hardly ever is it an accidental occurrence. So I thought that was really interesting, and it's a field that no one was picking up on. So I'm kind of pioneering this in Kenya, and I'm very passionate about bringing about change in this area, because the people who are injured or harmed or abused are people who are actually living through this injury, these traumatic experiences. And our current setup doesn't really have well coordinated structures to enhance the recovery and the investigations of these kinds of cases. And so I've found an area that really needs a lot of input, and so this is what I devote a lot of my time to. Initially, I didn't want to do medicine. I thought it was too hard. It's for really bright people. It's for nerds and geeks. It's for people who like to study and have no life. And I considered myself lazy at the time. Med school and lazy don't go together. But after weighing all my options, there was several other things I also wanted to do. I liked the way glamour looks. So I thought, people who wear uniform and look glamorous, flight attendants, they get to travel, they're really pretty. So there was that, but of course that I didn't really take that one seriously. There was music, because I really enjoy music. But at the time, that was definitely not considered a career option. So I dropped that. And then I realized there was no way to go around having to do medicine in med school. So I just went ahead and did it. Actually, everything worked out so that I had no choice. When my mom and I went into the office at University of Nairobi Chiromo campus, I was actually going to look at something else, but we needed direction, so we entered this office. I think maybe she just tricked me, now that I think about it. And the secretary and the staff there they were so welcoming, and they were like, you look like you should be a doctor. Just come look at this, sign these forms here, like that, just as a joke. And so anyway, that began the journey into medical school. I did work in the city mortuary for almost 3 years. In Kenya, medical officers also conduct autopsies because we don't have enough of the forensic pathologists. So this is the case for now. And so, but I worked under supervision. I was privileged enough to have forensic pathologists to work under because, here in Nairobi. And I enjoyed my work. I really did enjoy my work. Every minute of it, no complaints, because you're at least with the dead, they are not in pain anymore. With the living, they are in pain, and it's the beginning of a very painful journey for them. But with the dead, it's sad, yes, but there's no more pain and anguish to this person. This person is experiencing because they've died. So what we would do is just try to establish the cause of death and guide the relevant people accordingly. In forensic medicine, you have to know the law. A forensic medical practitioner is like a doctor, a lawyer, police officer. There's a lot you need to understand about the laws. Because we deal a lot with ethical principles. You deal a lot with, you have to understand how to deal with children, human rights. You need to know when a person has been violated or not, and you have to ensure that you are not the violator. So, for example, this comes in very, it's a very major issue when you're dealing with people in custody, especially, because it creates a very unique, different environment, because you're a doctor, you're working for the police, but you're also trying to help the patient who is maybe a suspect or a prisoner or a convicted offender. It's tricky, but you just have to understand the law inside out, at least the parts of the law that are touching on the work I do. So many acts I have to know, and even when you're in court giving expert testimony, I have to know what I can and cannot say. As a police surgeon, this is where the main impact was for me. And I believe it's because, again, you're seeing people who have been hurt, but they didn't die from it. They are now living through this desperate, frustrating, painful, traumatic life. And if that is not carefully managed, it really shifts and changes the way they think and the way they act and the way they behave. And I got to see firsthand the kind of shame and humiliation and trauma that, for example, a rape victim endures. You cannot understand it by reading it. You'll understand it when you see it. With the kind of despair they go through, the kind of pain and desperation children who are innocent experience at the hands of those who are supposed to protect them. So this is where, for me, there was a massive impact, and I decided to try and do something about it. And I'm glad that I ended up in this field, because this is where I saw that there's so much that needs to be done that and no one is doing. So I now am grateful for the time I have with my loved ones. I am grateful for my parents bringing me up the way they did. My mother was very, very cautious with where she left her children. we even thought she was overprotective. But after working in this field, I was like, thank God, because it's the people around you who actually are dangerous to children. Because of my experience in this field, I actually started an NGO called Vunja Kimya, which started as a blog to just inform people about things that they should avoid, things they should look out for, things that they need to know about, forms like the Kenya Police Medical Report form, where they can get help, which organizations will help you. I'm always ready and willing to help anyone in distress, or in, especially children and women, because they are the majority of victims. Not because I'm discriminating, but 90% of victims are women and children. That's a fact. So I'm always ready and willing to help them out anytime. Work-life balance. It sounds somewhat like a myth sometimes. Is there really a balance? But so I can say that for the beginning of the first 5 years, because I was now working in the police surgery, there was so much work. The patients, the court work, you can't even begin to imagine. And then I was in school at the same time, and I had a toddler at the same time. So it was really tough, because after work I'd have to study through the night, and so it was difficult to strike a balance. And I was always on the go, on the move, writing articles here, doing this and that, extra things, because I really wanted to help people. But eventually it did catch up with me, and I suffered, my body began to fall apart, so to speak. And I was hospitalized on 2 occasions because of this. And so I realized then that, if I'm going to be there for my son, I need to think about what is a priority and what is not. Typical days are very variable now. A typical day right now could be spent in front of the computer, just in one webinar after another, making presentations and having discussions with others in the forensic world. Or before that, I'd literally spend days in court, moving from different courts, at least for the better part of the day. And before that, I would be either at dealing with patients and then rushing to court and back to deal with patients, and then I go home afterwards. After a number of years in my career, I focused specifically on what I call the more complex cases, so the sexual violence cases, of children and adults, the murder suspect assessments, and sex offender or the suspect assessments of defilement and rape cases, and intimate partner violence. So that's because they require a lot of knowledge, forensic medical knowledge, skills and understanding, and require, after I see them, I also need to refer most of them somewhere, either counseling or call a children's officer, a social worker, look for a shelter. Sometimes you have to physically sometimes you get children who will come and they've come alone. No, you can't just let them go like that. So you have to take them to an authorized child protection agency. So it involves a lot of referrals, and you have to be really quick to think and all that. So because I had this training, I went through the Masters in Forensic Medicine at Australia. So I had the training for it, and I decided to just specialize on that because I felt I had the skills for it. I did have the skills for it. So the moments are pretty much all sad. They're all sad cases. A good day at work is when a police officer calls you and says, "Do you remember the advice you gave me? You told me to go pick up a swab from such and such a hospital." Yeah, that case, the suspect was found guilty based on the scientific evidence. That's a good day for me when such a thing comes my way, or that feedback comes my way. I'm very, very excited. Eventually now, there's more momentum when it comes to people realizing that, yes, there's something called forensic medicine that is required in very many cases, not just the dead. It's not just dead people who need forensic skills, it's also the living. So that for me is a good thing. Even when it comes to reviewing of documents like the P3 form, that is very, very it's a happy moment for me to see that actually now the hard work is paying off finally after almost 10 years. Yeah, so that's one of the times. And you know, when I've received a few awards for this kind of work that I've been doing, so those are also very high moments, very pleasant memories that have been created and motivate me to keep going.